Hi everyone. We're going to be talking about menopause today. Menopause is a biological transition between the ages of 45 and 55 and involves hormonal changes and physical symptoms. It touches on a woman's health, identity, and relationships. We will explore how menopause impacts sexual health, reproduction, sensuality, intimacy, sexual identity, and sexualization through the lens of daily circles of sexuality paradigm. It draws on intersectionality and social justice perspectives to show how racial, ethnic, socioeconomic, and sexual orientation variables impact menopause for women. These variables shape how women discuss menopause, influencing their self esteem and sexual well being. Menopause is frequently viewed as this biological process by the loss of menstruation and reproductive potential. However, it entails far more than hormonal changes. Many aspects of a woman's life are impacted, including her physical health, her sexual well being, identity formation, emotional relationships, and even social position. These elements interplay in a nuanced and comprehensive framework that enables practitioners and social workers to comprehend and respond to the full range of difficulties and possibilities throughout this life stage. It transforms sensuality through changes in body image and sexual responsiveness. It affects intimacy through evolving relational needs and communication patterns. It necessitates sexual identity renegotiation, and it confronts cultural narratives of sexualization that frequently devalue aging female bodies. Due to its emphasis on social justice, decency, and comprehensive care, social work is uniquely positioned to confront the complex challenges of menopause. Women who go through menopause see their hormone levels drop and might experience unique symptoms. They may lose interest in sex, have hot flashes, vaginal dryness, or even trouble sleeping. It is more than physical changes, though. It affects how they feel about themselves, especially around losing the ability to have children or how they see their identity, which is much more prevalent in some countries where this is tied to who they are. Some faith traditions highly value motherhood essential to womanhood, framing menopause as a symbolic loss of purpose. Others may celebrate menopause as an entry into elder status, wisdom, and freedom from childbearing responsibilities. Intersectionality can confound the process of providing care. Women of color may not receive the necessary care due to their inability to locate physicians who comprehend their cultural background or their restricted access to health care in their communities. LGBTQ plus people often deal with doctors who assume everyone is straight, so their needs don't always get addressed. Women with disabilities also deal with doctors who don't take their concerns about sex and menopause seriously. Sensuality refers to body image, pleasure, and comfort with one's body. Menopause brings significant physical changes such as weight gain, skin changes, hair thinning, and sexual discomfort, all of which may negatively impact women's body satisfaction. In the West, beauty standards made things worse by promoting the idea that women should stay young and look perfect, and that being able to have children is part of being attractive. As women age, they may start to feel no longer desirable or they can't live up to the standards. This can affect their sexual and intimate relationships, sometimes making them avoid sex or affection even if their partner is supportive. Black women often deal with stereotypes that label them as overly sexual when they're younger, but then ignore their sexuality as they get older. Asian women may be fetishized when they're younger and then overlooked as they age. LGBTQ plus women also struggle when doctors don't take their sexuality seriously because it doesn't fit into straight traditional views. To promote positive sensuality throughout menopause, social workers can provide psychoeducation, narrative therapy, and body image. Intimacy includes emotional closeness, trust, and relational bonding between partners. Physical changes, like painful intercourse, may create barriers to sexual intimacy, while relationship dynamics may be strained by misunderstandings or unmet needs. Some couples adjust by focusing on non penetrative sexual activities, increased emotional intimacy, and open communication to preserve closeness, even as sexual functioning changes. Even culture plays a role in what people expect from sex and marriage. Some cultures it seems that it's tough for women that don't have sex, and others it's totally normal. Sexual identity is how people see themselves when it comes to things like their gender, who they're attracted to, and how they feel about themselves sexually. Menopause can lead women to think differently about their identity as they get older, can't have children any longer, and go through changes in their sex lives. Western values strongly associate femininity with reproduction potential. When it comes to aging and the societal invalidation of what it means to be queer, LGBTQ plus women, the navigation of their sexual identity can be complex. Transgender women undergoing surgical or hormonal changes may have menopause like symptoms and endure discrimination in healthcare. Women are judged by how desirable they are, which is referred to as sexualization. Since youth is heavily valued in society, women going through menopause are often dismissed as seen as having less worth. Older women are often seen by healthcare providers and the media that they do not have sexual lives or desires. The devaluation is harmful to self esteem, intimacy, and mental health. Sexualization connects with race, disability, and sexual identity. Black women are often hypersexualized when they're younger and then seen as asexual as they get older. Women with disabilities are often seen as non sexual throughout their lives. To fully understand the change from adolescence to menopause, we need to use more in depth social justice based models. There are big differences in how women go through menopause based on their race, religion, sexual orientation, and social class. Social workers can support menopausal women at various levels. Professionally, engage in body image work, narrative therapy, trauma informed treatment, mindfulness based sexual therapy, psychoeducation, and couples counseling. At the community level, establish culturally sensitive support groups, work with local authorities, and produce educational materials that are suitable for a range of demographics. Advocate for insurance coverage for sexual health treatments, workplace accommodation, increase public funding for menopause research, and anti-ageism campaigns. Social workers can challenge these societal narratives by promoting body positivity, advocating for inclusive media representation, and educating healthcare providers about aging women's sexual needs. Social workers' ethical commitment to social justice requires addressing both personal and systemic barriers facing menopausal women. It brings both challenges and chances for growth, self awareness, and personal change. Instead of seeing menopause as a problem or deficit, social workers can focus on the strengths and resilience women show as they move through this stage of life. By advocating, educating, and practicing with a commitment to social justice, social workers can help shift how menopause is seen as a normal human experience that deserves respect, dignity, and complete care, including attention to sexuality.